Everybody, good evening and welcome to the second in our series of sexual and reproductive health talks. I'm Moneta Wilson. I will be the host of this little show. I am part of the leadership team of Herstoire. I am the female sexual and reproductive health advocate, and I advocate for female sexual and reproductive health. I like to talk about reusable menstrual products, but we also like to educate women about their bodies, about different things that affect their reproductive and sexual health. If you participated in the last talk, you know how this goes. Today, we are so lucky to have Charlotte Byrne, the director of the Fertility Center and Weight Management Center, and she will be sharing with us a little bit about her knowledge of PCOS. Thank you so much for joining us.
You're welcome. No, I'm very happy to be here tonight, and I want to encourage as many questions from everybody. I'm happy to answer as many questions as possible.
If you could very briefly give us a little bit of your background before we really get into what we're here to talk about today.
Yeah, so I am the director and clinical manager for the Fertility Center in St. Lucia. The center was opened 8 years ago, and it's been very successful in helping couples to conceive, especially those with PCOS, ladies that are not ovulating, ladies that have hormone imbalance. We recently opened the Weight Management Center 5 years ago, and this center is also successful in helping those that have cardiovascular diseases, metabolic diseases, problems losing weight, whether it be hormonal or it's hereditary. So we have the Weight Management Center and the Fertility Center. I am originally from England. I was brought up in St. Lucia and Grenada. I studied in Grenada at St. George's Medical University. I specialize in fertility and PCOS. That's my main areas of interest. And I enjoy my work. I love what I do. I love seeing ladies, announcing they've got a positive pregnancy test. I love helping ladies to lose weight, to have a healthier lifestyle, to, come off their metformin, reverse their diabetes type 2, all of these things. So I just love going to work in the morning. Yeah.
Awesome. So let's talk about PCOS, which this month is PCOS Awareness Month. What exactly is PCOS?
So PCOS, known as Polycystic Ovarian Syndrome, is a very, very common hereditary. It's metabolic, it's hormonal, it's a reproductive health disorder, and it's very common in the Caribbean. Throughout the world, it's common, but especially in the Caribbean. It's very much related to diabetes and insulin resistance. The whole syndrome has an umbrella of symptoms, so you'll find that some ladies may be experiencing facial hair, dark skin patches around their neck area and other areas in their body. They may be experiencing weight gain, especially problems with their reproductive health. They may not be ovulating, so later on down the line they realize they have some fertility issues. PCOS is a syndrome where most ladies that have this disorder have more of the hormones, which are androgens, which are the male hormone. So hormones such as testosterone, which is a male hormone. And that's why you see sometimes the facial hair on the chin, the weight gain, and an acne as well. So yeah, it basically has an umbrella of syndromes. It's not a nice disorder to have, and it's all about managing disorders so that you can have a better quality of life.
Okay, that's really great. So now we're going to have a poll going out, and you should see it pop up on your screen. There will be a question asking, are ovarian cysts and PCOS the same? And you can choose yes, no, or I don't know. So go ahead and choose something, choose one of the responses from your screen, and then we'll be able to see the answers, and Charlotte will then tell us the correct answer. Let me see if I can see the results. Hold on. There we go. I'm back. So I cannot figure out how to see the results. So if Robin, would you mind sharing the results with us? Everybody, Robin is also on the call with us. She's one of the co-directors of, there we go. So we had 42% say yes and 58% said no. So Charlotte will go ahead and let us know who's right.
So the simple ovarian cyst that's seen on a pelvic ultrasound, whether it be on, one on each ovary or two or three, a simple ovarian cyst is completely different to a PCOS cyst. So a simple ovarian cyst is a fluid-filled sac which sits on your ovaries, and it can disappear at any time. It can disappear with your next period. It can grow. It can cause immense pain. It can twist on your ovary. It can hemorrhage, but it's not the same as the polycystic ovarian cyst. The polycystic ovarian cysts shown on the pelvic ultrasound actually look like a pearl necklace around your ovaries. They're lots of little multiple cysts, and what they are, they're not actually cysts. They are immature follicles. So they're your eggs that have not matured enough, and they're sticking around your ovaries. So when you look at a PCOS cyst on the ultrasound, it's like lots of little cysts, multiple cysts around your ovaries, like a pearl necklace. Whereas the simple cyst would just show as simple cysts, just one or two.
Wow, so they're not actually.
So in that case, we wouldn't diagnose with PCOS.
They're not actually cysts. That's really interesting. I did not know that. And if you have questions, you can go ahead and ask them in the chat, and we'll go ahead and ask Charlotte. I do have an extensive list of questions, but this little word is not coming. This conversation is for you, so you can learn about PCOS and ask the questions that you need to ask. And there's no wrong question. There's no stupid questions. We all did not know at one time. I'm sure at one time even Charlotte didn't know some of these things, and we learn by asking questions. So you told us about the cysts in the the undeveloped follicles in the ovary and the pearl necklace, and you've told us about diabetes, insulin resistance, and other symptoms of PCOS. So you did mention that it's hereditary. So if my mom has PCOS, I will get PCOS. Is that what you're saying, or is it a little more complicated than that?
Not necessarily, no. It's not guaranteed that if your mum has PCOS, then you will get PCOS. No, it can be genetic, but it's not guaranteed to be genetic. If you understand what I'm saying, it does not necessarily mean that you will get it if someone in your family member has it. But we do see patterns of sisters having PCOS, the mum and the daughter having PCOS. So we do see that pattern, and we do keep a record of these patterns as well, so that we can look back and we have a medical journal that relates this to to see if it is a hereditary condition.
Yes. I understand, since I have endometriosis and my aunt has endometriosis, but as you know, to get endometriosis officially diagnosed, you have to have surgery. So no one else has had it officially diagnosed, but they have symptoms. So I kind of understand a little bit. Now, when we're talking about PCOS, at what age do these symptoms start? Like, how early can you get PCOS diagnosed?
So it can vary. You can notice on the onset of menstruation. So you may notice that, you're 14 years old, you start your period, and then you don't see another period for 6 months. So that absent period should bring up a warning sign that something's wrong with the hormones. Although sometimes it's missed, because when, girls do start their period, they do miss a few months, and the doctor might say, that's okay, that's normal at the beginning, and then they are sent away. But later on down the line, they may notice the weight gain, the insulin resistance, and the other symptoms. Now, it can also happen later on in life. It can happen, you can have your first baby, everything be fine, and then maybe by the time you're 35, you realize, you're putting on weight, periods become irregular, you're not getting pregnant with the second child, and you can develop it later on in life as well. So it can happen at any stage from the onset of menstruation.
Wow. That I definitely did not know that. So you see, okay, we have the chat is blowing up. I want to make sure that we get those questions. So there's a few different questions. There's that I'll just go through the questions because they're kind of all related. Someone asked, Bianca asked, can you determine based on your symptoms? Okay, she wants to know about how would you know which type of PCOS you have? Can you determine based on your symptoms? Or is there a specific test you need? And then, and someone else, Melinda Worrell, asked, is it part of your regular checkup process with your gyno?
So no, first of all, I'll answer the second question. It's not part of your regular checkup. If your gynecologist does a pelvic ultrasound, they may pick it up at that point, but it's not part of your regular checkup unless you've developed some symptoms. Now, there's not one particular test that we use to confirm diagnosis of PCOS. We have to use a combination of the symptoms that have been experienced and blood tests and ultrasounds, because you can have PCOS and not have any cysts on your ovaries because it's an oval syndrome. So you can have the syndrome but not show any cysts on your ovaries on the pelvic ultrasound. So that can be very confusing. So if a doctor sends you to get the pelvic ultrasound and it comes back ovaries are normal, they may say, you don't have PCOS, but you need to do another blood test to confirm whether you do or don't. What is the other question? I forgot, sorry.
The other question was about the type of PCOS.
Oh, the type of PCOS.
I was not aware there were different types of PCOS, so but maybe you can tell us about them.
Yeah, there's different types. There's ones where the androgen hormones are more present, such as testosterone. There's the insulin-resistant type, where you have problems with your blood sugar and you have to be controlled with metformin and so on. There's ones that affect your stress hormones, your adrenals, your cortisol hormone. There's different types of PCOS, and they're diagnosed via different blood tests. So, for example, for insulin resistance, we'll do the fasted glucose or the HbA1c. For your hormones, we normally we do it on day 3, which is the 3rd day of your period. So we'll test your luteinizing hormone, your follicle stimulating hormone, and your prolactin levels. And then we look at the correlation between the LH and the FSH to see if there's any hormone imbalance present. There's many more. There's the day 21 progesterone to see if you're producing enough progesterone. So we do the blood tests and we do the pelvic ultrasound and the blood sugar testing. So this is the main ways that we look to see what type of PCOS you have. But we also have to check your thyroid, because some of the symptoms that are similar with PCOS are similar to thyroid issues as well. So it's always good to check the thyroid function.
Okay, so you mentioned the testing on the different days and the different hormones, and I think this ties nicely in with Shauna's question. If I could just pull up the chat here, and also something we do when we do the Herstoire talks with the young ladies in the schools is to tell them about the menstrual cycle and the different phases. So, well, actually not Shauna. Anisha says, I have been prescribed letrozole to help me ovulate. My cycle is usually very irregular, but the last few times I have been experiencing 39-day cycles. On which day would I ovulate? So I don't know if you want to tackle that question or explain the different phases of the menstrual cycle first and then get to that question.
Yeah, so we have different phases of the menstrual cycle. And now when you have PCOS, this can be altered completely. You can have a shortened luteal phase or a longer luteal phase, which is the second half of your cycle. Now your luteal phase needs to be more than 10 days so that an embryo can implant. The first stage when the egg is developing is obviously the follicle stage. Depending on what days your doctor has told you to start taking letrozole, we normally say from cycle day 3 to cycle day 5. Can she confirm? Is that what day is free? Is she taking it 3 till 7 or 2 till 6?
If you could let us know in the chat, Kanisha, what days you take the letrozole, in what days in your cycle, she'll be able to let you answer that question.
3 to 5, 3 to 7, 3 to 5. Okay, so yeah, so normally about 5 days afterwards, you should be starting to have sex every other day for about a week. to cover that time when you should be ovulating. Now, letrozole is actually a breast cancer drug, but we use it to stimulate the ovary. So it's not specifically a fertility drug, but it's often used if Clomid is not successful. So we usually start with Clomid. I don't know if she has tried Clomid already. And if you're not successful with Clomid, we will go on to letrozole. We use letrozole from cycles day 2 to 6, actually. And then we do ovulation screen to confirm whether the letrozole has worked or not. But she can start having sex from 5 days after the last tablet.
She said her doctor did start her on letrozole first.
Okay, yeah.
So Linda wants to know if you can have both PCOS and an ovarian cyst.
Yes, you can. You can have both, definitely. So we've seen many ultrasounds where you have the PCOS looking cyst, but you also have a functional cyst as well.
Okay, and since I like to talk about myself, can you have endometriosis and PCOS at the same time?
Definitely. So you can definitely be, that would be the, very bad case scenario, but it would be, you'd be very unfortunate. So you can have PCOS and be having endometriosis as well. And unfortunately, there's not really a cure for endo. It's about managing it, whereas PCOS is there's a lot more things you can do, I guess, to help you conceive and things like that. So yeah, you can definitely have both of the disorders at the same time.
Okay, so we just want to do a few different myths really quick. You did mention facial hair. So does that mean if I start having like lots of chin hairs, does that mean I might have PCOS, or is it like a certain amount of chin hairs before I should think I have PCOS?
Right. So because many people experience, 1 or 2 hairs, they shouldn't be concerned about having PCOS unless they have any other symptoms. If they start to develop, like a full beard going on, then definitely it's something to look into. But normally you're having 1 or 2 symptoms. You won't just have one symptom. You'll probably be experiencing irregular cycles and weight gain and things like that as well.
Okay. And you also talked about weight loss. So does that mean that PCOS only affects overweight people? Is that a disease of obese people?
No, that's not true. We have many, should I say, skinny, small ladies that come to the clinic who have been diagnosed with PCOS. So it's not about being overweight to start with, although it does help if you lose weight if you're trying to conceive and you want to regulate your cycle, especially changes in diet. That's very helpful in managing the PCOS. But no, you can be big to start with, you can be small to start with, you can be obese to start with. It doesn't affect the diagnosis at the time. We wouldn't not send you for a test if you're small, for example. We would still send you to be tested because it's a hormonal disorder.
Now you've talked about infertility. So do all people with PCOS experience infertility?
Not necessarily. About 80% of persons that we see in the clinic with PCOS have problems with ovulation in terms that they don't ovulate. So we do this by checking their day 21 progesterone levels. And if they're not ovulating, then what we would do is we'll put them on progesterone medication. We will change their diet and we will start using the fertility drugs. Now we start with Clomid first, and then we will go on to letrozole as a second option. And we go up from 50 milligrams to 100 milligrams and so on. Now, because these fertility drugs are quite strong, they tend to be quite successful, although they sometimes can result in multiple births, such as twins and triplets, because they can overstimulate your ovaries, especially if you're quite underweight. It can be a little bit more of a powerful effect. So we do end up with some twins and triplets. It's not extremely common, but we do let the ladies know that that's obviously one of the side effects. And yeah, so it's not just because you have PCOS does not necessarily mean that you cannot conceive. You can conceive as long as there's no other factors involved, such as you're over the age of 45 or you have any other medical conditions that we should know about.
Excellent. Now, we're going to have another poll going up about the treatment of PCOS. So Robin is going to put that poll. You should see it pop up shortly, and you can go ahead and pick an answer. But in the meantime, there we go, there it is. So you can choose, does hormonal birth control cure PCOS? You can choose yes, no, or you can choose I don't know. So if we could go ahead and choose an answer, and then we can start talking about the treatment of PCOS. But while they're doing that poll, we have a question from Kesson, one of our volunteers in Herstoire. She asked, can hypothyroidism be related to PCOS or have similar symptoms such as weight gain?
Yes, so hypothyroidism and PCOS have very similar symptoms, as I just mentioned, such as the weight gain. So we will always check the thyroid function blood test as well as the hormonal blood test, so that we can rule out that the thyroid is not causing the issue as well, because the thyroid can affect your fertility as well, and also some medications that are taken for the thyroid, whether it be underactive or overactive, can cause problems with the fertility drugs. So it's definitely something that we test for before we start medication.
All right, so the poll, everybody should have chosen their answers now, and we can see the results of the poll shortly, and then we can continue to talk about treatment of PCOS. Poll results, there we go. So does hormonal birth control cure PCOS? We have 6% said yes, 76% said no, and 18% said they don't know. So if you could just take us through some of the ways you treat PCOS, and hopefully that'll answer some of the questions we have in the chat right now.
Sure. So it depends on the person that's coming to you. So it could be a student, for example, with PCOS. The student is not interested in conceiving at all. They just want to have a regular cycle. They don't want to experience any prolonged bleeding or any months where they're missing their period, where they feel bloated and uncomfortable. Say, for example, they have their exams coming up, so they just want everything to be regular. So at that point, what we would probably do is we would check their blood sugar levels, and the medication would be metformin, which is a diabetes medication, and probably put them on birth control. So birth control, what it does, it regulates your cycle. It does not cure PCOS. In fact, it kind of covers up your symptoms because it makes you believe that everything is okay. But once you stop taking the pill, you'll find that if you were having a irregular cycle before, that will come back, because you have done nothing in the meantime to treat it in terms of changing your diet or taking progesterone or anything like that. So the pill works in a good way that, say, for example, as I said, if you were a student and you just want to carry on life as normal for now. So if it's someone coming to me now that wants to try and conceive, the pill would obviously be the last thing I would put them on. What we would do is we try to regulate that cycle and get them to ovulate naturally first. So we'd put them on progesterone tablets. We would change their diet, because diet plays a really, really important part. We may use supplements like inositol. We may use metformin, anything to control their blood sugar as well. So that's what we would do in that case. And then if they're still not ovulating, we would go on to the fertility drugs like Clomid and Letrozole. Now, so the treatments for PCOS vary depending on the person that's coming to you and what they want from it. You understand? What I prefer is not to use the pill for anybody, because I just see it as a cover up. You know, it's synthetic hormones. It's telling you to bleed. It's telling you not to bleed, but your body's not doing it itself. So when you come off it, you're in the same situation. And by that time, you've probably put on weight, you've got more facial hair, more acne, and so on. So I generally don't use the contraceptive pill unless it's we don't use it unless it's an emergency, such as really prolonged bleeding and things like that. We tend to use more natural therapies.
Okay, so you mentioned prolonged bleeding twice, and you hadn't told us about that as a symptom of PCOS. Can you expound on that a little bit?
Yeah, so lots of ladies that have PCOS will experience very irregular bleeding, whether it be they skip their periods for like 6 months, and then when it does come, they have this really heavy, long bleeding episode where it doesn't stop until you take a medication, such as Primulute, or go on to birth control. So that's very, very common. That's something we see a lot in the clinic, is this prolonged bleeding where you bleed more than the normal, 5 to 7 days that a period should be.
Okay, so we had some very specific questions. Sharon asked about she read that people should avoid all dairy and wheat. Is that correct? So if you could talk about dietary changes, and then we'll go to Bianca's question next, because those were very specific medication wise.
Yep. So with PCOS, I mean, there's lots of things on the internet that says you shouldn't eat this, you shouldn't do this. Now, we are working on what we found the best results with. So I don't see any problem with dairy. We found that to be okay. The main culprits in terms of exaggerating PCOS symptoms is the white flour, sugar, and white rice. So anything that contains these three enemies, I call them, we cut them out completely. In terms of meat like chicken, fish, turkey, pork, ham, I do not have a problem with that. Lots of peas, beans, and lentils is fine. Vegetables like broccoli, spinach, kale, cabbage, pumpkin is fine. Your gram provisions is okay, although they're starchy and they do convert to sugar in the body. We recommend maybe twice a week with the gram provisions, and probably the smallest portion on your plate. But yeah, wheat is okay, but as in whole wheat, but not the white flour.
Okay. Person asking you guys also live on Facebook. I think we are getting some questions from Facebook. So I'm going to read Bianca's question, and then I'm going to check in and see if I can get the live on Facebook if there's any questions going on there. So the chat, Bianca says, oh, someone also asked really quickly about soy as well. And then Bianca said, if you try Clomid and it does not work, can you take inositol, D-Caio, and Mayo instead of letrozole?
It doesn't work in the same way. It has completely different actions. So the letrozole is a drug that stimulates your ovaries, where the myoinositol is more of a blood sugar regulation supplement. So they're kind of completely on a different spectrum, although when your blood sugar is regulated, your menstrual cycle starts to regulate as well, but it doesn't induce ovulation the same way as Clomid or letrozole. So what I would recommend is if you started off with, say, 50 milligrams of Clomid, you ask the doctor to put you up to 100, 150 is the maximum you can go up to. It's very, very important now to make sure that before you even try fertility drugs, that you've done a HSG, which is where you've had your tubes flushed. Because if you're overstimulating your ovaries and for some reason the sperm meets the egg and it happens in your tubes and there's some type of scarring or blockage, we're going to end up with an ectopic pregnancy, which can be life-threatening if your tubes burst, okay? So it's always good to make sure the doctor has you do a HSG before putting you on any type of fertility drug.
Okay. So, as someone who has endometriosis, who had their tubes flushed and such things, it seems like the management of PCOS is intense and complicated, as is the management of endometriosis. Someone in the chat asked where the fertility center was located, and I would also like you to say, for those not in St. Lucia, how would they, because that's always a thing for me, is how to find and choose the best doctor so you can get the best possible outcome in managing your chronic illness.
Okay, so we have 3 centres, we have 3 clinics. We have one in Soufrière on Church Street, we have one in Vieux-Fort on Clark Street, which is where Dr. Lendor's office is, and we have one in Rodney Bay, which is our main head office, which is right next to Baywalk Mall, actually. If you are abroad and you want to do an online consultation, we do offer these as well, but I do travel to Dominica, Grenada, Carriacou, Antigua, where else? Yes, I do travel around and have clinics on those islands as well. But if you're...
Oh, wow.
Yeah.
You're everywhere. You're everywhere. Wow. Okay, so let me just check the chat really quickly before I move on to my other questions. There's so much good information. Like, people are saying that it's amazing and they're really enjoying it. And okay. I think I've got all the questions in the chat. If I missed your question, just type it again. No big deal. I'll make sure to get to it. So I want to talk about, because reproductive health is not just reproductive health. So it's not just about making babies, but does PCOS affect sexual function?
It can affect your sex drive because you obviously have these androgens, these male hormones. So you may feel a little bit dry down there because you have lack of progesterone. You may not have any sex drive at all. And also because PCOS causes all these symptoms that can affect your self-esteem, like the facial hair, the dark skin, the weight gain, and so on. You may not feel comfortable to be in any sexual relations because you may feel depressed. Mental health is a really important aspect of PCOS, which shouldn't be missed out as well. It can cause depression, it can cause anxiety, and we've seen this in many cases. So we make sure that we take a holistic approach when dealing with PCOS clients so that we deal with every single sector, every single symptom. So yeah, there's a lot of ladies that have problems with their sex drive because of the hormone imbalance, because of the low self-esteem as well. So it's a combination of both. But in terms of affecting your reproductive system, it's the ovulation, which is the main problem, and you may experience, obviously, those really painful, heavy periods, prolonged bleeding, or lack of periods.
Okay, well, I was going to ask about mental health, but you already you already touched on that. Earlier in the chat, and we did not get it, someone asked if PCOS was reversible.
It depends. I can't say it's fully reversible, but it can definitely be managed very, very well. So, for example, we could get your blood sugar under control. We can get if you're overweight, get you to lose weight. We can get your menstrual cycle regulated naturally without using birth control. We can get you ovulating on your own without using any type of medication, such as fertility drugs. We use other type of herbal medications. So yes, we can definitely get it completely managed so that things are working completely fine in terms of your reproductive health, and also keep your blood sugar levels under control, reduce the facial hair, use progesterone therapy so that it helps with your acne and the dark spots on the skin as well. So I can say it can never be completely cured because it's always there underlying a little bit, but we can definitely make it manageable and make your life quality much better.
Okay. So, I have lost my train of thought. Oh, yes, it's back. I have fibromyalgia, folks, and one of the great side effects is sometimes my brain just does what it wants. So, those of you who don't know me may not know that my regular job, when I do it, is as a yoga teacher. And as such, I wanted to know, what are some of the supportive and holistic therapies other than the medication, the diet, that can really help people with PCOS, whether it's managing it or reversing some of the symptoms?
Right, so managing stress is really, really important because when you are stressed out, you produce a hormone called cortisol. And when that starts to pump through your body, it inhibits, it stops ovulation, it causes all these menstrual cycle delays where your period comes late. I don't know if some of you may have experienced times where you've been really stressed out and your period has been a few days late. So stress does affect your hormones, it affects your metabolism, the way you put on weight, it affects many things. In fact, stress is the #1 killer in the United States. You can see things on the outside. Stress may cause you hair loss, itchy skin rashes. Stress can cause things on the inside as well that we don't see, which can affect your cardiovascular diseases, your digestive system. So stress is very important to manage. So we recommend yoga, for example, any type of relaxation techniques. So things that make you relax, yoga, meditation. We offer vaginal steaming. Anything that makes you go in and completely relax, breathing techniques, just so that you can reduce that amount of stress in your daily life. Because sometimes we take on so much and sometimes we put it on the back and then it all builds up. So we make sure that it's offloaded and we teach you ways which we can reduce that stress.
Okay. So, for those who don't know, could you explain what vaginal steaming is?
Yep, sure. So vaginal steaming is a therapy we use at the centre. We started using it in Dominica about 5 years ago, and it's been quite successful. We use a combination of specific herbs for the type of condition that we're treating. We place them into a pot with boiling water, and we have a steam sauna in our clinic. So basically what you would do is sit over the steam. So it's like a sauna that you sit on with towels, and you relax, you have a cup of tea, listen to some music, and it's your time alone. We leave you there just to relax, but it also helps with specific conditions, especially with endometriosis. We normally suggest that you steam 3 days before your period and 3 days afterwards to help with that cramping and that pain that you may be experiencing. So we had some good results with the steaming as well.
Yes, I did try the steaming a while back from the recipe I got online.
How was
Except
it?
my mom was supervising.
Oh,
It was actually really, my mom was supervising. She was
yeah.
supervising and bringing me tea and telling me that I should be doing this more often and I need to do it every month. And she would remind me, she's like, isn't it about time for you to steam again? But it was
Oh,
really relaxing and did help with
yeah. It's very good.
it's time for you to steam again. I think my mom was like, I think all women should steam.
Mm-hmm.
I'm like, so are you going to steam? No. So we have some very good questions coming up in the chat.
Sure.
One person wants to know, well, let's stay on the topic of vaginal steaming. You said like for endometriosis, 3 days before and 3 days after the period. Oh, I have some herbs that I may
depends on the client. I mean, we do like an intake.
Yes.
We will like assess them, but generally speaking, yes.
Yes. So it would depend on what the person is experiencing, and they would have consultation first.
Yes.
So someone wanted to know how to arrange an online consultation.
So the online consultation, the best way to do it would be to go on the Facebook page, Fertility Advice St. Lucia, and just drop us a message, and then we will get in touch with you and we will go through the whole procedure with you of how to get that done. You would need to have a PO box, a US shipping address, and a PayPal account as well, so that we can go ahead and do that.
Okay, great info. So let's see, we had something come up in the chat. Okay, so Bianca said, you mentioned that your tubes would need to be flushed to ensure that you are not overstimulating the ovaries. Would you need to visit a doctor to have this done, or is there a natural way to do this at home? That's one of two questions. So I'll let you answer that question, and I'll come back to the second question.
Okay, so the reason for the HSG is not to check to see whether we are going to overstimulate your ovaries. It's to check to see if there's any blockages in your tubes. So to check to see if there's any scar tissue, if you've had chlamydia or an STD in the past, that can cause blockages as well. So we check that those tubes are clear so that when we do stimulate your ovaries, the egg comes down nicely and there's not going to be any type of pregnancy in your tubes, which is a ectopic pregnancy. Now, the HSG is only done at 2 places, which is St. Jude's and Owen King. They're the only 2 hospitals that do the HSG, and it is a very painful procedure. I don't know, Mo, how did you find it? Did you find it painful?
Oh, they did it. They did it when they did my laparoscopy. While they were in there, they did it.
Nice.
So, well, they opened me up and they found a giant cyst. And while they were in, so I did it in New York. So I had a laparoscopy. I had excision of the endometriosis. I had the tube thingy. I was peeing blue for a while. Oh, blue things were coming out. And then I had endometrial biopsy as well.
Oh wow! So you got it all over.
So that was fun.
Yeah, I'm sure.
Yeah.
So
While they were in there.
While they were in there.
Since I had PCOS, it was my second surgery in the year. He just wanted to make sure I had options if I wanted to have a child, because it didn't make sense to clear out the endometriosis and not check, because sometimes there'll be scarring inside the tubes anyway, so you have to check.
Oh yeah, that's good.
Yeah.
So I can explain the process. of the HSG, how it happens. You are taken into hospital. You are lying down on the bed, and a saline solution is pushed through your cervix. It's pumped through your cervix into your tubes. So at the same time as it's coming in and through your tubes, an X-ray machine is coming down, and it flashes. It takes an X-ray, so it shows you whether that fluid can make its way through your tubes, the same way as a sperm and an egg. And it's quite painful, yeah. So you should take paracetamol if you ever have to do this. But you need a referral from a doctor. It's not something you can just go and get done. Mike's cringing.
I had the one where they freeze your cervix as well.
Oh yeah,
like
precancerous.
That one's also, yeah, that one's also really painful, and they have to dilate your cervix for that one too. That's fun.
Yeah.
Okay, so we have a ton of questions in it, tons of questions. So would you be able to get Robin, if you could just answer in the chat if they'll be able to get a recording of the meeting? It should be on the Facebook page for sure.
It said
okay. So the second question after well, let's go back to this. So if someone is in Dominica, they would not be able to get the tubes flushed? So is there an option to get that HSG in Dominica?
In Dominica, I believe Dr. Ferreira has a machine, but it's not called a HSG. It's called a saline solution. So it's very similar to HSG. So the saline solution is pumped through your cervix again, but at this point, instead of the X-ray, he will do a ultrasound to check to see whether that fluid goes through. It's not as reliable as the HSG, but it does give us an indication as to whether the tubes are blocked. But check Dr. Ferreira. Yeah.
Okay, so then we have a very, oops, not that, no, cancel. We have a very specific question, so I want to make sure I read it correctly. If you tried 50 milligrams and 100 milligrams of Clomid and it did not work for you, would you need to get your tube flushed before trying another fertility drug? So I think what you're saying is before you even get those drugs, you should be checking the tubes.
Really, you should be, yeah, because you don't want to have an ectopic pregnancy. But I don't know this person, so I'd be checking, first of all, has their partner done a semen analysis? Because, you know, infertility can be on one side, it can be on both sides, it can be joints. So you'd have to make sure the other checks have been done. So the semen analysis for your partner, the HSG to make sure your tubes are clear. Obviously, age is a factor. I don't know how old. They don't have to tell me how old they are, but obviously after 35, it becomes a lot harder to get pregnant. Clomid doesn't work for everybody. So that's why we switched to letrozole as our second drug that we use. And also you can't just take fertility drugs without making the other changes that we do at our office. So we change your diet, we put you on progesterone. You need to do all these things with the fertility drug. You can't just take the drug and expect it to work one time because you have a syndrome. So you need to start treating all the symptoms and then take the fertility drugs when it's safe to do so.
Okay, so I think the takeaway here is what you're saying is that PCOS is a syndrome and it cannot be treated. Like you can't just take a pill and make it go away.
Yeah.
You have to holistically approach all of the sides.
Yeah, exactly.
Most things you have to do approach them from all sides. Most things you actually do, you know, it's just that sometimes we just take the antibiotics and then don't drink the water.
Yeah. You can't expect it to be a miracle pill if you don't do the other changes first. Because if you haven't changed your diet and your blood sugar is unbalanced, and then you take Clomid, even if you do get pregnant, you may have an early miscarriage. The same as if you don't bring up your progesterone levels first, again, it can result in an early miscarriage. So what you're doing is like torturing yourself, taking these tablets, getting pregnant, having a miscarriage, because you're not fixing everything else first. So that's what we do at the center. We don't just give you tablets, we will fix everything first and then make sure it's safe to give you the tablets.
Yeah, so it's like you have to have a lifestyle change.
Exactly. Right.
I tell people having a chronic illness is like having a second job. It really
to manage it.
It really, like, everything runs around it, you know. Um, okay, so we've had like a lot of interesting talks and a lot of interesting points come up, and we have about 10 minutes left. Oh, okay, I know what question I was going on to. So let's say you're 15, you've maybe had 2 periods 6 months or more apart, and you think, and you have weight gain, or you've had a lot of weight gain, you've had the facial hair, or maybe you're like me, 37, your periods were always regular, and all of a sudden you've gained 50 pounds 50 pounds in 1 month. And 30 pounds 1 month. It's okay, we're dealing with it. And the weight's not going anywhere, or like your periods have become irregular, or maybe you have more facial hair than normal or something, and
Right.
you think, hey, wait, maybe I just might have PCOS. So what should you do? What's the first step?
So the first step would be to go and see a general practitioner, a doctor, or even better, a gynecologist, someone that specializes in PCOS and diagnosing this condition. So I would recommend, in terms of talking about gynecologists on Ireland, Dr. Samuels at Tapion, she's great, and Dr. Lucia Charles, who else? There's other doctors in Beaufort, such as Dr. Lendor and Dr. Louisi. So there's quite a few good ones that are really good at diagnosing the PCOS, especially in the younger ladies, because at that point in time, obviously their self-esteem is really affected at 15 if you put on weight and you've got this facial hair going on. The only thing is, it's not dealt with holistically sometimes, so they're not getting the counseling to understand the condition, the lifestyle changes, the diet changes. So that's where we come into play. So doctors will refer them back to us so that we can teach them what they need to do now to manage this condition.
Okay, so first order of business, go to your regular doctor. If you don't have a regular doctor, you can go to
your gynecologist.
But also, I want to mention, off of our last talk we had with us, Nurse Jean Charles from the Beaufort Sexual and Reproductive Health Clinic at the health center, and he did mention that they do have a doctor on staff that actually, for those who don't have the resources, can refer them for testing and that sort of thing.
Yeah.
Now, if you don't have access to, for some reason, you don't have access to medical care right away, are there some changes you can make in your lifestyle overall, that in case maybe it's endometriosis, maybe it's PCOS, maybe it's
endometriosis.
Maybe it's PCOS. Hey, as long as I didn't say asthma. In case it's PCOS, that you could just make these changes anyway, or even if you don't think so, just so you can experience better reproductive health or better health overall. Some changes that we should all be making to our lifestyles if we cannot make it to the doctor, or just in general.
I mean, it's always good to get a diagnosis and not to leave it too long, especially if you're in your reproductive years and you want to try and have a baby. But if you can't afford to go to the doctors, or for some reason you can't get medical care at the time, it's always good in any reason to change, keep a good lifestyle. So to eat healthy, to do regular exercise, get enough sleep, manage your stress, practice yoga, meditation, and so on. Make sure that your stress levels are low. And even if you do just 30 minutes of walking a day, that can be quite sufficient. Make sure that you eat healthy. You don't eat too many sugary drinks and things like this. But because this syndrome has so many symptoms, and some of them can be a little bit dangerous, such as if your blood sugar goes sky high or it drops really low, these things need to be monitored. So even if you can't afford maybe to see a gynecologist, you can always go into your health centre and request the blood sugar test and so on. And you can even go and get a referral to do your own pelvic ultrasound. And then depending on those results, we normally invite people to send the results to us and we can read them for them as well. So yeah, I wouldn't leave
Okay.
too long, but there are changes you can make.
So there are options, and I know from experience, you just walk into the health center, you say, "Hey, I'd like to check my blood sugar,"
Yeah.
and the nurse or the aide you down and say, "Why do you want to check your blood sugar?" They'll have a little consultation with you, and
Right.
based on the results, they can recommend where next that you can go.
Then they might refer
Where you can go. To the doctor or to the hospital or to the reproductive health clinic.
Right.
And from our last talk, we learned that there is a reproductive health clinic at the Polyclinic, at Castries Health Center, Castries Health Center, Viewfort Health Center, and Soufrière Hospital. So at those, you can find out about the reproductive health clinic. You can get tested for some of the most common STDs, and you can get any reproductive health issues checked if you cannot afford. But if you want to go to your own doctor, your private doctor, of course, that's more than welcome, since they'll probably have a full history for you. And of course, like Charlotte said, that you can get your own ultrasound. There are many places that you can walk in and ask for an ultrasound and send the.
You can do a patient request. So you can just go in and choose the pelvic ultrasound and tell the ultrasound technician maybe some of your symptoms, and then when you get the report, you can just bring it to us or take it to a doctor if you're concerned.
Okay, good. So we have about 5 minutes left, and we do want to mention, Robin, would you like to come on screen and join us and tell us about the giveaway?
She's gone to sleep.
This is my coping strategy. How I keep myself in a good mood is to get excited about everything that's good.
Why not?
So it's a
So
giveaway.
Very briefly, we do have 2 giveaways where people from this live get extra entries, and we'll be promoting it from tomorrow on our social media platforms. But you get first dibs by putting your email address in our comments in the chat. You get 5 entries, and I'm gonna let Charlotte describe what the giveaway is on her end. But from Skin Envy, for those with PCOS or who have any facial hair or any issues like that, you get a free laser hair removal. So if you are interested and you are in St. Lucia, even if you're not, I'm sure it's transferable. You can give it to someone who you love and care for in St. Lucia. Go ahead and enter your email addresses in the chat, and we can send you the recording as well for this session, and you get 5 entries for the giveaway. Follow us as well on Instagram and Facebook to get additional entries as we promote from tomorrow. And we'll be doing the drawing, I believe, on Sunday. And on to you, Charlotte, to describe your amazing giveaway that you'll be doing.
So I'm going to give away from the Weight Management Center a free weight loss consultation. So this includes your weight management weight loss tablet. It includes acupressure session for weight loss. It includes meal plans and access to our weight management group where we share meals and things like this. And it includes blood sugar and blood pressure and BMI testing. So you get all of that included in your session. So it's a really nice holistic session. It takes about an hour, and it covers acupressure, your weight tablets, and we get you to have a nice healthy lifestyle and lose some weight. That's my giveaway.
That is so exciting. That's so exciting, y'all. So you get from Skin Envy and you get from Charlotte as well. Do we have any final questions in the chat? Because we're heading to 7 and I am tired, and Charlotte has been so generous with her time, spending an entire hour with us. So if you have any final questions, if you would, you could put them in the chat. A recording of the chat will be emailed out to everyone. And if you have any other questions, Charlotte, can you tell us how they can reach you if they have further questions or would like to book a session?
Yep, they can reach me. The easiest way to reach me is on WhatsApp, 714-5006. If you're not in St. Lucia, then it's 1758-714-5006. So that would be the quickest way to reach me, and I respond on WhatsApp.
Okay, y'all. So there you go. Y'all got her WhatsApp number. Y'all in. This has been really, really, really productive. We got all of these questions answered, all of this great information. One final question, and when you will be back in Dominica.
Bianca, how are you? I'm just waiting to see when the quarantine settles down, and also when this COVID situation is a bit more settled. So I'm hoping maybe by January or possibly as early as December, but let's see how it goes. But I do miss you guys. I want to be back soon.
Oh, yes. And we do have a final poll for feedback on the session, so that will pop up on the screen. And while that's going on, we have the first question. After this talk, how much do you think your knowledge has increased about PCOS? Very much, moderately, slightly, no change. So if you could go ahead and put your answer in. And then if you could press next, you can let us know whether or not you actually have PCOS. Okay, so you like the number again. Let me put that in the, if we are going to, okay, 714 5006. So I've put it in the chat. Okay, I did not put it like I wanted to for everyone to see. Putting it again. So I've put the phone number in the chat for those who want to go ahead and grab it. And also, people are asking, will we be doing this again? Yes, we will be doing this next month, last Wednesday of the month. I am really enjoying this series. If there are any topics you'd like us to cover, reach out to us. You can reach out to Herstoire on social media. You can respond to, I think the email that you got for the meeting should have Herstoire's email address. You can reach out to Herstoire on any of our social media accounts if there's topics you'd like to cover, and we will be having another talk next month, and we will be talking about breast cancer awareness and things about breast cancer, like we talked about things about PCOS today. So as we can see, my brain is getting tired. Thank you so much, everyone in the chat. I don't know if you're seeing the messages flying by or saying this was amazing. Thank you so much for all the information.
Thank you so happy for me. I really enjoyed it, and thank you to Mo and the Herstoire team. Robin, it's been amazing, the awareness you've done for the whole of September. It's just been brilliant. The posts we've seen on Instagram, on Facebook, everywhere. It's been really great for awareness. So well done to you guys as well. It's excellent.